Welcome back. Here's to a positive story, which I know you and I need. South Africans continue to break new ground in the medical field. One of them is Dr. Katleho Limakatso of the University of Cape Town. He's broken new ground on pain management for amputees experiencing phantom limb pain or agony. As a cherry on top, he completed his doctorate in only 3 years and will become UCT's first black PhD holder in Anaesthesia and Perioperative Medicine when he graduates on Friday. He joins us now virtually to tell us more about this project. Katleho, first of all, congratulations from the eNCA team. This is quite a huge, achievement for a person, for anybody really. So just tell me a bit more about graded mortar imagery. How exactly does it work? I thought if my leg is amputated, the nerves are dead and therefore I won't feel pain. So I guess I'm wrong?
Thank you so much really for the congratulatory messages and greetings to you and your viewers. So phantom limb pain, it's a common condition that we see in people with amputations. And it really is bothersome and startling for many patients because they struggle to understand the reasons behind experiencing pain, even though the leg is not there anymore. So myself and many other colleagues around the world have done a lot of research towards understanding the mechanisms underlying phantom limb pain. So what we have discovered is that phantom limb pain is primarily driven by mechanisms in the brain. So just to give you a quick explanation of how it works, in our brains we have what we call brain-held body maps. Meaning you have a map with an exact representation of all your external body limbs. So for example, in as much as you see this external hand, we have a representation of that hand in the brain. So during amputation, the external hand is taken away. But by the fact that that hand is missing, it doesn't mean that its representation in the brain is gone. In fact, the representation of that limb is always present in the brain. But what we have seen is that because of a sensory motor deprivation as a result of an amputation, there are functional changes that occur in that area that once invaded the amputated limb. And more interestingly, we have seen that there's a correlation between the extent of these changes and the severity of pain, meaning the greater the extent of these functional changes in the brain, the more severe the pain. But what we found interesting is that these changes can be addressed with a positive correlation between their reversal and pain relief. So we use graded motor imagery as a strategy to target these functional changes in the brain with an aim of reducing pain.
So basically, would it be sort of like numbing the memory that the brain has of that particular limb?
The treatment, it's not a psychological treatment. I think one thing that we have to understand with phantom limb pain is, contrary to popular belief, it's not, previously people were thought to be mentally ill, some were classified and stereotyped as being crazy because of the pain that they felt. It's not a matter of psychology, even though it may play a role to some limited degree, but it's a matter of functional changes in areas that control sensation and movement in the brain. So those are the targets for treatment. And what we have seen is if we address those changes in those areas, we get to see patients improving remarkably.
Katleho, tell me, in terms of you making this breakthrough, what does it then mean for the ordinary South African, especially those who cannot afford private health? Have you gotten into any conversation, for instance, with government officials to be able to probably add this treatment, even for the poorest of the poor?
That's a brilliant question, and this is the main motivation for the work that we do here in the Department of Anesthesia at the University of Cape Town. So what we have seen is that phantom limb pain was previously managed using expensive surgical procedures, expensive interventions, and pharmacological drugs that may not be useful in some cases. And all of these treatments, what we have seen is that they are not effective for managing phantom limb pain, and even beyond that, they are really expensive. And most of our people who suffer from phantom limb pain are in impoverished areas. They don't have monetary resources to access such care, which in most cases is not helpful. So with credit motor imagery, it's a relatively cheap or affordable treatment that patients can access within the hospital. But what we also do is to train them during their treatment sessions so that they can continue with treatment at home. So we have been training many clinicians all over South Africa, but primarily here in the Western Cape, as well as some parts in KwaZulu-Natal and Gauteng. So we've been rolling out this treatment, and clinicians who are using it are seeing positive outcomes as well. So this currently remains the best treatment for phantom limb pain, both in its clinical usefulness, but also in the evidence that we have. So just quickly, we recently ran an expert Delphi study where we invited all the experts from the world, from North America, Europe, Asia, and all over the world to participate in providing treatment recommendations for phantom limb pain. And we found it interesting that credit motor imagery was one of the top 2 treatments that were recommended by the experts all over the world. So this is really exciting for us, but also very exciting for our patients who will get the care that they truly deserve and need.
All right, Katleho, thank you so much for your time. I wanted you, if you can, in just 2 lines, a message of motivation to that young black person who's looking at you right now and is thinking, one day I also want to be the first of something. Just 2 sentences quickly.
It is possible with the right amount of dedication, consistency, hard work, and support. Everything is possible. Thank you.
Thank you. Thank you very much, Katleho Limakatso. Speaking to us there, he is Dr. Katleho Limakatso, in fact, who is set to become UCT's first black PhD holder in anesthesia as well as perioperative medicine on Friday when he graduates. All right, let's take you to